Welcome to my channel, RX Sam 2020. Today we discuss a drug named Nortriptyline. This medication is used to treat mental mood problems such as depression. It may help improve mood and feelings of well-being, relieve anxiety and tension, and increase your energy level. This medication belongs to a class of medications called tricyclic antidepressants. It works by affecting the balance of certain natural chemicals, neurotransmitters, in the brain. Nortriptyline is generally better tolerated than amitriptyline. As with many antidepressants, its use for young people with depression and other psychiatric disorders may be limited due to increased suicidality in the 18 to 24 population initiating treatment. In the United Kingdom, it is also used off-label for the treatment of a panic disorder, irritable bowel syndrome, migraine prophylaxis, and chronic pain or neuralgia modification, particularly temporomandibular joint disorder. Medical use. Manic depressive psychosis in the depressive phase. Neurotic, endogenous, reactive, involutional, or masked depression. This medicine is used for neuropathic pain, attention deficit hyperactivity disorder, ADHD, smoking cessation, and anxiety. Nortriptyline is a less preferred treatment for ADHD and stopping smoking. It may also be used for treating nocturnal enuresis, with courses of treatment lasting no more than 3 months. What is Major Depressive Disorder, MDD? Also known as clinical depression, is a mental disorder characterized by at least 2 weeks of pervasive low mood, low self-esteem, and loss of interest or pleasure in normally enjoyable activities. Attention Deficit Hyperactivity Disorder, ADHD. ADHD is a neurodevelopmental disorder characterized by excessive amounts of inattention, hyperactivity, and impulsivity that are pervasive, impairing in multiple contexts, and otherwise age-inappropriate. Nocturnal enuresis, also informally called bedwetting, is involuntary urination while asleep after the age at which bladder control usually begins. Bedwetting in children and adults can result in emotional stress. Complications can include urinary tract infections. Dosage. For depression. Oral. This medication is in capsule or liquid and is taken by the mouth 1 to 4 times a day, with or without food. Doses are usually given at night. Adult. Initiate at a low dose, then increase as necessary to 75 to 100 mg daily in 3 to 4 divided doses or as a single dose. The maximum dose is 150 mg daily. Elderly. Initiate at a low dose, then increase as necessary to 30 to 50 mg daily in divided doses. The maximum dose is 50 mg daily. Dosage. For nocturnal enuresis. Oral. Child, for patients who have failed previous therapies. 6 to 7 years 20 to 25 kilograms, 10 milligrams daily. 8 to 11 years 25 to 35 kilograms, 10 to 20 milligrams daily. Greater than 11 years 35 to 54 kilograms, 25 to 35 milligrams daily. All doses should be given 30 minutes before bedtime. Treatment duration is less than or equal to 3 months. Contraindications. Nortriptyline should not be used in the acute recovery phase after myocardial infarction, with heart attack. The use of tricyclic antidepressants along with a monoamine oxidase (MAO) inhibitor, linezolid, and intravenous methylene blue is contraindicated as they can cause an increased risk of developing serotonin syndrome. Special precautions. Closer monitoring is required for those with a history of cardiovascular disease, stroke, glaucoma, or seizures, as well as in persons with hyperthyroidism or receiving thyroid hormones. Pregnancy and lactation, contraindicated. Pediatrics, reduce the dose. Elderly, reduced dose necessary. Side effects. The most common side effects include dry mouth, sedation, constipation, increased appetite, blurred vision. Tinnitus, tremors, mental confusion, irregular heartbeat, an occasional side effect. Serious side effects. Serious side effects may include seizures, an increased risk of suicide in those less than 25 years of age, urinary retention, glaucoma, mania, and a number of heart issues. Drug interactions. Increased plasma concentration with cimetidine. Increased risk of hypoglycemia with chlorpropamide in type 2 diabetic patients. May decrease the antihypertensive effect of guanethidine, dibrusoquine, bethanyline, and clonidine. Barbiturates may increase the rate of metabolism of nortriptyline. The risk of arrhythmia and hypertension may be increased when given with anesthetics. CYP2D6 inhibitors, for example quinidine, may increase nortriptyline toxicity. Potentially fatal, increased risk of serotonin syndrome with MAOIs. For example linezolid, intravenous methylene blue. Brand names that are mostly prescribed by doctors. Allegron, Tamalor, Primox, Sensible. What should be avoided while taking nortriptyline? Excessive consumption of alcohol in combination with nortriptyline therapy may have a potentiating effect, which may lead to the danger of increased suicidal attempts or overdosage, especially in patients with histories of emotional disturbances or suicidal ideation. Mechanism of action. The consensus is that nortriptyline inhibits the reuptake of serotonin and norepinephrine by the presynaptic neuronal membrane, thereby increasing the concentration of those neurotransmitters in the synapse. Combinations. Gabapentin plus nortriptyline is a combination of two drugs. Gabapentin belongs to a class of drugs called anticonvulsants, whereas nortriptyline belongs to tricyclic antidepressants. Gabapentin works by binding to the specific site on voltage-gated calcium channels. This helps in relieving nerve pain and lowers the risk of seizures. On the other hand, nortriptyline works by preventing the released chemical messenger in the brain, serotonin and noradrenaline, from being reabsorbed back into the nerve cells, neurons, in the brain. As a result, it prolongs the effect of serotonin and noradrenaline in the brain and prevents the movement of pain signals in the brain. Nortriptyline plus pregabalin is a combination of two medicines. Nortriptyline plus pregabalin is indicated for managing neuropathic pain associated with diabetic peripheral neuropathy, postherpetic neuralgia, spinal cord injury, etc. Pregabalin is an anticonvulsant that affects the chemicals in the brain that send pain signals across the nervous system. Nortriptyline is an antidepressant that increases the levels of nerve transmitters, serotonin and noradrenaline, in the brain, thereby reducing the pain messages arriving in the brain. Together, Nortriptyline plus pregabalin helps to treat neuropathic pain due to nerve damage. Thanks for watching. Please subscribe and like this video.